To me, Xerosis is the consequence of some skin irritation that sometimes is clinically evident after post-inflammatory conditions, otherwise could be subclinical, as happens, for example, in elderly patient or in atopic dermatitis. And this condition could be genetical condition or a consequence of environment, and so in this respect could be also a disease, subclinical sometimes disease.
So for you it can happen during skin disease, inflammatory skin disease? Yes. Or it can be a genetically driven condition?
It depends. If you have an atopic dermatitis or have ichthyosis, you can have a genetic predisposition to this condition that environmental factors can trigger and induce more severity on this. But if you have an inflammatory disease, every inflammatory disease that induces erythema, desquamation, you get also xerosis in every conditions.
For me, dry skin is a symptom, and you can feel the symptom. I mean, most of the patients, when you touch them, you can feel the scaly skin, and the patients, if you have to touch them and you feel the dry skin, that's I think what makes it really easy to diagnose dry skin. And of course, it's not a disease. Dry skin is not a disease at all. It's a symptom, and it can become a disease in advance. If you do nothing against dry skin, it can become a disease. Of course, in elderly patients, you can have an exicationseczem, or you can have atopic dermatitis if you do nothing against dry skin. So there are many different ways where dry skin can go to. So for me, it's a symptom. Nothing else.
So if I don't have samples, which I often have, I always write down 3 names of emollients that I think are good products. Yes, and I ask them to try all of them to find out what's best for you. And I feel that really helps. Yeah. That's the feedback. Yeah.
And
they want it very concrete. Having the names.
I do the same, and I as the disease is symmetrical, I'd say put it in one hand and one in the other hand in other, and then make the difference between the two. And I think this is quite good idea, and you have to do the same with the third, and you have to choose. The only thing is the cost of this product, because if you buy 3 or 4 products,
yes, that way they have to buy 2 products. And I don't know if they are comfortable with these.
I would prefer try this one. If you don't like it,
samples,
try the second one. If necessary, try the third one, rather than doing some experiments. Some patients could like that.
But some patients like it.
I always ask what they had already used.
Yes.
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 Because if I don't, maybe I prescribe what I have been doing before going to the consultation.
And if you like your emollient, keep it.
Yeah.
Rather than change it.
Yes, yes, yes.
Yeah. And everything that you talked about that, and you too, the cosmetic aspect of the thing that we prescribe. Because most of the people come to the consultation, even if they have a psoriasis, because it's a cosmetic disease, everybody can see. People ask me, do you see more cosmetic or more ethic? Even a mole that is in here or here without being a melanoma, they come because they don't like it. So it's cosmetic. If you treat psoriasis without atropathic psoriasis, arthritis, you have to treat with things that are cosmetic, and the people like to put even products that has some perfume or something that the people, I like to do that, because it's impossible to say this is very good and you put it. They don't apply the things that we give them.
We hope to have in the future more targeted therapies when we know what kind of anomalies in the epidermis is responsible for for dryness. Compliance is an important problem. This is that kind of topical products, but then we probably have to give the choice to the patient and let him choose the product he prefers, choose the product he prefers. Are you okay with that
Yes.
conclusion?
Yeah. Yes, very well. Thank you.
Okay. So maybe you have some question to ask?